me for the latest edition of the Kre Me Show. Come on, come on. Welcome. Today we're going to talk about COVID-19 tracking. COVID-19 tracking, guys. Hey, it's Dr. Kre. Thank you for joining me for the latest edition of the Kre Me Show. Come on in, tag a friend, bring a friend. Join us. I'm Dr. Kre. I'm your board certified family medicine physician, and I specialize in helping everyday overwhelmed, overworked people live healthier, happier, whole lives. And I do this through education because I feel like when you know better, you can do better. So tag a friend. Today we're going to talk about COVID tracking. So I've been seeing everybody, all the craze, all the rave, you name it. People have been upset about the tracking that they have been getting, the COVID-19 thing that they've been seeing on their phones. So has anybody seen it on their phones? I have an iPhone, and it must not be time for my phone to update yet because I have not seen it. And I looked up on it. If you don't know where to look, hey Latressa, hey Tanja. If you look under health, under settings, you have to go to settings, look up under health. Hey Montez, today I'm doing my live through Instagram and Facebook. So welcome, guys. So anyway, so if you go under your settings, hey Press, my uncle's here from Memphis. If you go under settings and you go under health and you should see it there. So y'all have seen it. I haven't seen it on mine. So let's talk about what this means, what they're trying to do. So what they're trying to do essentially is contact tracing. Hey Lenora, contact tracing is already happening. Whether you have a app on your phone or whether you have or not. So this has been something that's been used for ages. So in the health department realm or the Department of Public Health, if you've ever been tested for an STD, so say for instance, if you've ever been tested for a sexually transmitted disease and you came back positive, or someone that you were in relationship with came back positive, they would then say, hey Miss Smith, your test came back positive for syphilis, for herpes, for gonorrhea, for chlamydia, for whatever it is. I don't think they call you about gonorrhea and chlamydia. Hey Chris, but for syphilis, for HIV, hey Darvon, then they would say, we need to contact your partners. So then you have to list out all the people that you've been sexually active with. And then from there, they would then call them on the phone and say, hey, someone that you've been in touch with, someone that you've been in relationship with has come back positive for herpes. That is contact tracing. That's contact tracing at its basic level. And even with coronavirus, I had patients that called and said, hey, someone called us from a strange number, and they were talking about asking me questions about who I had been around, and these people actually had been COVID-19 positive. Well, that was probably someone calling from a health department. During the last few months, people have been working from home. So they may have been calling from a private number. They may have been calling from their cell phone numbers. They may have been calling from numbers that you don't recognize. So that's the hard part about contact tracing in this day and age. With the robocalls, with the calls where you're like, I don't know that number, I'm not answering. I'm like that all the time. I don't know that number. And especially if they be calling from an unknown number, you know no one will answer, right? So that's the big thing. So that's how the old school way of doing contact tracing, and that still goes on today. If somebody in your neighborhood gets positive for tuberculosis, somebody from the health department will show up at their latest address and like say, hey, because they don't want anything like coronavirus to happen. They're trying to keep whatever that disease, that disorder is. They're trying to make sure to keep that under wraps. And they won't tell you who told them. Yep, exactly. They won't say who it was. They won't say who told them that that you've been exposed or whatever. So I want y'all to know that that's the basis of what they're trying to do with cell phones. So this is called contact tracing. Somebody put that in the comments. Contact tracing. So first and foremost, they would not and should not be sharing your personal information. How this is supposed to be done is it has the ability for you to say, you can turn it on or you can turn it off, right, guys? You turn it on and say, okay, I want to be able to be pinged and to be able to see and know if someone around me has had the COVID-19. So, essentially, everybody's been kicking against the prick, as the old people say, about this. Like, I need a new phone. I don't want to have an iPhone anymore. I don't want to have a Samsung anymore because this is on there. But other countries are seeing great results from it. Their numbers are going down because I've heard stories of when people come into the doctor's office, you hand them your phone, and there's something with the app. They have to partner this with an app. So you get contact tracing. So you do the contact tracing, you hit on, and then it uses geo mapping or Bluetooth or GPS. It uses those things, and it just kind of, just like our location. And it says, okay, someone's been in this, you were around somebody for closer than 6 feet for more than 10 minutes, they had coronavirus. Like that's a big thing. So the public health agencies are supposed to be coming up with their own app, their own thing, so that you say, I'm gonna download this app from the Alabama, or whatever your state is, Department of Public Health. I'm gonna download this app, and I'm gonna turn on my phone, and the two of them together will show me how to do contact tracing. So I would know if I was around someone that's had the virus. It would show me. Hey, Darlene. Hey, y'all. Thanks for joining. Let me know where you guys are joining from this edition of the Dr. Kre Me Show. So guys, listen. This should be a good thing. So it's not like it's on your phone. You have the capability of being on your phone, just like you have location, the capability to turn your location on and off. No one requires you to turn your location on. You share your location or you don't share your location, right? So they should not be going in there, getting your information, saying, I'm getting your bank account, your social security number, all that kind of stuff. That's not the gist of this. This is to help the numbers that are continuing to rise. Dallas and Houston, they are out of ICU beds. They are out of hospital, beds. This is bad, guys. We are not in a second wave. We are in the first wave that has continued to go. Because the wave is just going. New York in the house. How y'all doing up there, Lenore? How things are in New York? But I don't think East Amherst is near the city. So, how is it up there? Hey, Kajina. Anyway, so what y'all miss is we're talking about contact tracing. And we're talking about the good old days of the health department calling you if your partner or somebody that you were sexually active with had an STD. If they had syphilis, they're going to find you and say, hey, you need to be checked for syphilis, so that you don't continue to give syphilis, you don't continue to give HIV, you don't continue to give herpes, you don't continue to give whatever it is. That is a reportable disease. So you have to report it, and then they go find you. Or tuberculosis. What you're seeing on your phone, you're seeing it on your phone such that you can turn it on under the health panel, and you can turn it on in the app when the states release the app. So you can turn it on, and on both those sides, they communicate, and they either send Bluetooth or they send geo mapping, or I'm not technical like that, or GPS to say, and it tracks people who have actually been positive. And it can say, oh, I'm within 6 feet of someone that have had the virus. So it tracks people who have the infections. Lenore says their numbers are coming down. Hey, Dr. Hamizodi. So it tracks people who are infectious. They use the Bluetooth or geo mapping, and the goal is to help decrease the spread. So we want to be able to say, people are ashamed, y'all, to say that they have coronavirus. It is so sad. They don't want to tell the people around them, so they continue to mingle with them. They continue to frolic with them. They continue to be social and go to weddings and parties and cookouts, knowing good and well that they have coronavirus. Hey, Shay. Knowing good and well that they have the coronavirus, because they are afraid of that it's going to be a stigma associated. Now let's just be clear, guys. Let's be clear. There is no stigma. There should be no shame associated with the fact that if you have coronavirus, which is a viral illness, a respiratory illness, it doesn't have, it's not said, we're not talking about anything indecent. You just walked outside and got it. You touched something and got it. Hey, Tiffany. So, let's get free in that. Like this whole thing that people are going to judge me because I have it, let's get that behind us, okay? Behind us. I need you to be able to say that this is something that you get well from, hopefully. Hopefully you get a mild enough disease that can take you out. But if you're sick, you want to let those that you love and those that you've been around, don't continue to go to work because you feel like this is something you have to. We'd rather you be alive than not, okay? So you have to install that app, and the app pairs with the Over There in Health. So you have to tell the people you had it. They won't just assume that, oh, Kre went to the doctor, so she must have coronavirus. You have to do parts. There are steps that you do on your side to say, yes, I'm positive. And so that way it can track people who are infectious using a Bluetooth that are within 6 feet, guys, and for more than 10 minutes at a time. I think that it would be great to have, that way I know, like, maybe I shouldn't go to that restaurant. Maybe I shouldn't go downtown to that specific area if that's where everybody in this neighborhood had coronavirus, or everybody that's going to this church has had it. Like, let's be smart, guys. All of this, it's an infringement on our rights. Yes, somebody should have made an announcement to say they're going to put this on your phone, that it has nothing to do with it. So what is the app? I'm sorry. I'm like, oh, it is not, the app is not an app yet, Michelle. So if you go inside of your phone is updated lately, it has to be since a recent phone update. So you will be able to look under the settings if you go under health. And under health, it usually has your blood type, your medicines, your height, your weight. Under that, and it will say COVID-19, and you can turn that on and off. Right now, I think everybody's is set as off because that has to pair with an app that is created by the Department of Public Health. So I don't even think there's in America. I don't think that there's any active apps. I know not in Alabama. I'm gonna say in Alabama we don't have any active apps to connect that with. So it's not grabbing your information if you don't give it permission. Just like we have locations on our phone, it's not gonna tell that you're not where you're supposed to be if you don't have locations on. So that being said, it tracks people using Bluetooth, geo mapping, and the location, the setting, you do that, and the GPS. And it says if you've been within 6 feet of someone for more than 10 minutes, then you will know, hey, I need to go get tested. I was exposed. If you came to the doctor, I checked that I had it, and I was there examining you, you're going to get a little ding to say somebody you around is not going to say Dr. Kre had COVID-19 and she exposed it to you. It's not going to put you under the bus like that, guys. It's going to just say you've been around somebody. And you've been in an area where there are all these, several people, that kind of thing. And the goal is to isolate it. The goal is to encourage more testing. The goal is to help our numbers start to go in the right direction instead of going up, and away. School is about to start in 2 months. Me and my husband did a survey this morning about if we were comfortable with our kid going back to school. Like, all of that is just, it's a lot to think about. But we have to think about more than summer, the beach, hanging out, kicking it, and being normal. This is our new normal, guys. Wearing a mask is our new normal. Start getting your kids wearing their mask now. If you're planning on your child going back to school, start getting them used to wear. Put the mask on. Let's go out a little bit for the mask so they can get used to it. Don't touch your face. Keep it up. Breathe normal so you don't hyperventilate with the mask on. So the goal of the tracking is to help show what hotspots are on the map. So if it's 100 people in some little small town in Alabama, you might not want to stop there and get gas. Like things like be smart. And it's also to show you who you've been around, that kind of thing. So it will forecast, and then it can also show hotspots. So that's what's going on with the contact tracing. Contact tracing is already going on because if you've had a positive, your doctor had to report it to the health department. So the doctor reported you to the health department. The health department called you and was like, who have you been around in the last so many days so we can notify them? But you probably didn't answer the phone because you don't answer random numbers. You don't answer unknown numbers. So I'm sure that it's getting harder and harder to track. And then people just won't tell the truth. So today I encourage you to be honest. If you have it, tell those around you. If you think you got symptoms, let your doctor know so they can direct you to go get tested. Every doctor's office isn't doing testing. I don't do testing in my office, but I direct my patients on where to get tested. Just be wise. Be wise in that the countries that have been successfully doing tracing have seen numbers go down. I saw that in Georgia. They're trying to go door to door and draw blood and do antibody testing. I'm not for that because I don't know what y'all gonna do with my blood unless y'all gonna test me and hand me my blood to throw away, after you show me my results. But that gets intrusive. But this is something that you decide to participate in or not. It is not something that they're going to go in the night, turn this on, and install the app, and it's all there for you. So, once again, this is Dr. Kre. I'm your board certified family medicine physician. I specialize in helping everyday overworked individuals live healthy, happy, whole lives. I hope today that you've learned more and more about the need for contact tracing. And there is indeed a need for it. Now, how we go about doing it, I think that's a work in progress. And I encourage you to read up on topics before you just jump out there and just give yourself on the way that you're not even finished paying for. Okay? Anyway, follow me at Dr. Kre, DoctorKre on Instagram. Follow me on Instagram. If you're not following me there, follow me at Dr. Kre on Facebook. Either or. I thank you guys for coming. I will see you guys next Tuesday. And shout out to Dr. Jared and Honey Envy. That's who did my hair. That's whose hair products I'm using today. She's one of my friends. Look up Honey Envy as Honey, Honey Envy. Check her out. She has a new natural hair care line, and she's amazing. So thank you for joining this edition of the Dr. Kre Me Show. I'll see you next Tuesday at 2:30. Thank you.